Insulin is actually life-giving, but it is also not as safe as people may think.
I do think people can see positive, subtle shifts as early as 48 hours.
Yesterday, I got a message from one of my colleagues in Vancouver, and she's saying, my first patient has returned and he's doing amazing. And I go, yeah, and it's going to still improve.
If you think that this topic is on your radar, I think you should talk to your own veterinarian. Copper coming from liver is an entirely different thing than copper sulfate as a powdered synthetic lab-made add-in.
But when I see human skin, it looks so weird. It's actually thick. Like, I don't really like human skin.
Yes, no.
I'm just like, hello. We are all fired up. Hi, everyone. Hi, Karen.
Hi, Peter. How are you?
I am fantastic, awesome. I actually slept under the stars last night. And that doesn't happen very often, but my friends invited me for a little camp night, and it was amazing. And I slept on the truck, and Pax slept beside me, and it was fantastic. And I was thinking, I have to sleep really well because today, which is a Sunday, we have to talk about hormones again, part 6.
So exciting. You know, we've had such a beautiful response to our desires to not just talk to other veterinarians about what we're seeing clinically and what we're seeing epidemiologically and what we're seeing with our own animals. We wanted to be able to kind of create a safe space and a platform and videos that allow us to start a conversation. And we did that. And now we're doing number 6 by popular demand. It has been a fun time being able to we've had the conversation for a long time, but we're starting kind of a platform for pet parents and veterinarians and researchers to be able to come and continue the conversation in a way that's safe, but also allows us to learn more. And that's why we're moving on to part 6.
And we so appreciate your questions and comments, and even some comments that we were possibly chit-chatting in the series. But you know what? This is not anything official. This is not a lecture. This is not anything else but trying to get the community together and put the information together and make sure that we actually, as we progress, that we learn more and we become more and more solid in the information that we have and we know and understand. And also we'll be able to share more success stories because there are many colleagues now who are actually contacting us, and they've been putting their dogs on and their patients on hormone replacement therapy. And it's so lovely to hear. Yesterday, I got a message from one of my colleagues in Vancouver, and she's saying, my first patient has returned and he's doing amazing. And I go, yeah, and it's going to still improve over the months and beyond. Karen, how long do you think it takes just to kind of complete the changes or to see the change happening?
Peter, I think it's so individualistic because I think that every physical body, depending on breed and age and genetic predispositions, that there's all these variables that make each case so individualistic. And I think that it's difficult to predict that. I do think people can see positive, subtle shifts as early as 48 hours. I think that for some of our older patients like Homie, that the joints and long-term cognition things, it could take a little bit longer, 4 to 6 months before you're like, okay, my goodness. But I do think that across the board, the overwhelming resounding response has been, oh my goodness, this is really good. And I can't wait to see the further improvements or changes with what I'm seeing. Are still unfolding. Peter, would you say that Pax has reached kind of the peak or the precipice of his ongoing journey with supplemental testosterone therapy? Do you feel like he's done, or do you feel like there's still maybe more down the road?
It's so funny that you must have read my mind because I was just thinking about it this morning when we went to the beach and he was running and just kind of like full of beans. And I will show you a video here maybe. The change has not stopped. And it's kind of mind-blowing because what I've been noticing is that when I compare, let's say, photos of him a year and a half ago and now, I can't even use the photos from a year and a half ago because he looked okay, but he looks now in comparison ratty. Now he's got like full mane, like beautiful coat. And even 3 months later, people who haven't seen him, let's say for 2-3 months, they say, oh my goodness, his coat is even better. So I'm actually still seeing that positive year and a half later, I'm seeing this positive change. And obviously, I expect him eventually to start aging. But right now, I get more and more comments about, is he a puppy? And that is, the best compliment to HRT, but also just so sweet, like so wonderful to actually hear and see. And so, yeah, I don't know. I'll take it, but we know that nothing lasts forever, but let's enjoy whatever we have. How about Homie? How is he with doggies that come by?
So I'm in that phase when you said aging's happening. So I'm in that phase with Homer where the original symptoms that really prompted me with our private conversation, over a year ago now, where you're like, you should just try this. And I was like, he's 17. Really? Like, at what point do you just say, all right, I am that mom. I'm that wound type A girl that's just going to try everything and let's just keep patching and doing more and doing more. There comes a point when you're like, let's just stop pushing and let aging, like, just relax, take a deep breath and be like, okay, I've done as much as I can. I'm just going to let the body go and let the body degenerate. And the question is, at what point, for me, ethically, morally, along a 17-year-old, really old geriatric dog, at what point do we expect an old dog to continue to learn to do new tricks? At what point do we say we're going to stop? And I, being type A wound tight, didn't. I was like, I will just try this one thing additionally and see how it goes. And we are still seeing, Peter, the additional fruits of having Homer on HRT. We are seeing him be able to be in more social situations with more diversified stimulus that could trigger him to be reactive, and he's not. But concurrently, am I seeing aging taking place? I am. For instance, most recently, he has gone from nuclear sclerosis, normal age-related changes that he's had since we adopted him. He now has like the beginning stages of cataracts. So am I watching a very senior geriatric dog become more geriatric? I am. I'm watching things change. Like, he has now older man eyes. He went from old man eyes to older man eyes, but at the same time, I'm not going to stop the hands of time just by supplying HRT, but am I doing things to keep his quality of life so far above average from where it would have been without it? I am. So is age taking place in Homer's body? Yes, and I'm seeing that. But am I slowing it down by having the powerful contributing factor of HRT on board? I am.
He's 17, which is an amazing achievement, obviously. And
He's in 24 days, he'll be 18. 24 days.
birthday celebration next
Yeah.
time,
Yeah.
maybe.
Yeah.
So
Yeah.
I just want everyone to understand what we're going to go through. First, we'll go through general questions and mainly about how to get the hormone replacement medication. And also, we'll be talking about some different forms of testosterone. And Dr. Karen Becker has actually experience with that. And then we'll move into female dog issues and the questions that he asked, and then we'll move on to males, and then we'll close up with some of the challenges and problems that we have. So why don't we just start with finding the right veterinarian? Karen, can you give people an advice where to find the right veterinarian?
I think right now, Peter, at least in the US or North America, the where I am instructing people to go to is threefold. If you've reached our platforms via social media, you're not in our space, you're maybe a casual pet parent and you just stumbled across something and now you're on our page and you think, wait, what are you talking about? To be able to get the depth and breadth of the basics of this topic, I would go to Parsemus, because Parsemus Foundation is a nonprofit that has been investigating safe birth control for mammals of all species for many, many years. And they actually have the directory of veterinarians that provide hormone-sparing sterilization options. And they also are beginning to offer the directory of veterinarians offering hormone replacement therapy. And our goal would be that it would be quite clear who's offering hormone replacement versus who's offering sterilization options that preserve hormones. But the fact is, that still would be the first place I would recommend clients or pet parents go to. However, if you are in the integrative space, then I would say go to your veterinarian who probably has read this information, heard about it, is keeping up with CE. They're recognizing the overwhelming body of evidence that is being presented about all the studies coming out. So it's on their radar. If you think that this topic is on your radar, I think you should talk to your own veterinarian. about, hey, do you have injectable testosterone? Because I know like a lot of equine practitioners, a lot of other species were using injectable hormones for different things. They may be able to provide testosterone cypionate in an injectable form already, and then it makes it quite easy. But then third and lastly, you can go to CIVT edu.org or ahvma.org. Those are two platforms that have directories of integrative and functional medicine or holistic veterinarians that would at least be more open, Peter, to having the discussion about securing the totally safe, non-toxic hormones necessary to correct this condition.
And my experience is that there are people reaching out about how to do hormone replacement therapy, and I've talked to a few veterinarians. Dr. Karen and I are planning to gather veterinarians maybe in a meeting and just kind of answer questions, and maybe have Dr. Michelle Kutzler, the original researcher of the studies that we've kind of resourced from, and Dr. Linda Brent. Parsemus is a great starting point. And I just talked to Dr. Linda Brent, and she said that there is a drop down list that actually sorts out the people, the veterinarians who do hormone replacement therapy and those who do hormone sparing sterilization. So if you're looking for one or the other, please go to parsemus.org, and the information is there. Now, we are moving on to where to get the medication. And before we talk about how to get the medication or how to kind of make connections with your vet, I just want to talk about the stigma around testosterone. Now, in veterinary medicine, if you have a dog that is diabetic, for example, you will get, your dog will be diagnosed with diabetes, and then you'll get instructions how to administer insulin at home. Now, not many people point out that insulin is actually one of the most useful hormones that we can use, obviously, for treating diabetes, but also sustain life. But it's also one of the most lethal. Like, if you actually take the vial of insulin and you inject it into a person or dog, you can kill them. So, insulin is actually life giving, but it is also not as safe as people may think. In contrary to that, you cannot kill anyone with testosterone or other hormones, estrogen and so on, sex hormones. And at the same time, there's this weird stigma, Karen, right, about it not being prescribed, or people should not be taking it home and all that. But what do you think of this kind of comparison between insulin and testosterone, and how do you see it?
I find it interesting that as veterinarians, as general practitioners, we graduate from veterinary school knowing that if we have a diabetic patient, to save their life, we will teach the owner how to administer insulin and they will do it at home. Likewise, for an Addisonian patient, we would show our clients how to administer steroids. And sometimes it's orally, but initially, oftentimes it is injectable. But the fact is, we're using then steroids, which also prednisone, prednisolone, dexamethasone, we're using drugs that people say, why would you ever give catabolic steroids like prednisolone? So we're talking about anabolic steroids, which is testosterone, and catabolic steroids, which is prednisolone. Why would you ever give these to any animal? Because in some cases, Peter, their life and health span and well-being depends on it. So if you're Addisonian and you do not get life-saving catabolic steroids, the patient will die.
Absolutely.
If you are sex hormone deficient and you don't get testosterone, you will die of chronic degenerative diseases that will express themselves over time depending on your body's weak link and your genetic predispositions, as well as the lifestyle you're in, the food you're eating, the air you're breathing. All of those things will come together. And there's going to be some epigenetic triggers that are pulled that are going to trigger the cascade of degenerative diseases that will express itself over time. So when we think about why are we so nervous about prescribing steroids, which are both anabolic testosterone and catabolic prednisolone, it's because prednisone, you don't need a controlled substance. So veterinarians, let's just take for allergies, Peter, we hand it out like candy, oftentimes with terrible side effects. That's a whole different topic.
Let's be clear.
We
We
don't.
don't.
But
I,
our profession, yeah,
unfortunately,
you
still,
know,
still, with good
yeah,
intention,
still.
again, with good intention, but Steroids are prescribed more than they should be. And on the other hand, we don't see a real positive effect of sex hormones on metabolism and overall well-being and quality of life. So we will need to adjust how we kind of see testosterone and estrogen and so on. I think that
Yeah.
people are used to, and we talked about it in the previous series, people are used to Arnold Schwarzenegger or someone like that who were dosing themselves much greater doses, non-physiological doses, and that's a different thing. But if you have this discussion with your veterinarian, maybe it is actually a good idea to talk to them about, okay, I would love to inject it at home. Please, can you calculate exactly what the dose for my dog is? And don't give me anything more until it's used. So that's actually a safe way of actually handling this whole situation, because I think that when it is about health and disease, we need to really try to figure out ways how to maintain health. And that means in neutered and spayed dogs or older dogs, hormone replacement therapy.
And don't you think, Peter, that part of that can be role modeled after the human health industry? In the last 5 years, humans are recognizing that we are hormone deficient, and they're teaching humans how to apply appropriately dosed hormones at home to allow for our physiologic well being. And so I take a topical estrogen and testosterone, and I do that to help balance my hormones. And I'm happy to talk about that as it relates to Homer's balancing of hormones. And I think that those conversations are necessary. And I think along those same lines, talking about the stigma associated with prescribing hormones for veterinarians, but also the legalities, because in the US, we can get injectable testosterone cypionate, which is what I'm giving Homer, because I have a controlled substance license. I can order it, I can keep track of it. It goes in a safe. It has a very rigorous log. I can prescribe it to the 0.01 cc, and I know exactly who it's going to, and I can show the DEA all these things. Great. In other countries, even if you have a controlled substance license, you can't get the injectable medications that are best used.
Yeah. There are a few things that we still need to sort out or kind of get used to. But what we want to say primarily is that testosterone is not only safe, but it can be managed in such a way that it's not abused. And so when you reach your veterinarian and when you have this conversation, number one, tell them that you're willing to kind of like find a way. And there's also transdermal application. And Karen, I know that you've been using transdermal with Homer. I've been using injectable with Pax. Can you tell us about transdermal?
Well, Peter, I actually use injectable with Homer when I'm here to be able to draw it up myself and administer it, because I'm the one with the controlled substance license. I travel a lot. I like right now, I'm writing book 3. I'm traveling all over getting interviews. When I'm gone, Homer can't take a break from his hormones. So, because my 84-year mother will be taking care of Homer when I'm gone, I have had, you won't be able to see it, but I have had
We can see that.
I have had compounded medication for Homie made into a topical transdermal that goes inside of his pinna on the inside of his ear so he can't lick it off. I just rub it on the inside of his ear. And this is, in essence, this is the same testosterone I am taking. It was made for Homer at a human pharmacy. It's not the same pharmacy, but it could be. This is just this topical testosterone cypionate that goes in his ear. And as a veterinarian, I called the pharmacist. I said, I'm going to move from injectable to transdermal. He needs a milligram per dose, and the compounding pharmacist was able to make it for us. So then Homie is able to consistently stay on his hormones while he's not able to get injectables because I'm gone. And this allows us to not have a breach in his treatment protocol, but allows us to continue providing what he needs so he can have consistent physical and emotional well-being while he's not getting injections. So we do a hybrid protocol.
And based on what you said, if let's say the injectable dose is, let's say, 14 milligrams per week, we will divide it into 7 doses, which means 2 milligrams. And then you go to the pharmacist, or a vet goes to the pharmacist or calls them and says, I need to deliver roughly about 2 milligrams per day. And then ideally, maybe a few weeks, few months later, we will measure the levels and see whether they are appropriate. And that would be the ideal protocol. So now we have two options. One of them is injectable, which is a little more accurate and reliable on the level of how much we administer. And it can be obviously assessed a little more accurately when you do those tests. But also there's transdermal, which is a little easier to administer. And I have a feeling, especially if your vet is hesitant to give you an injectable testosterone, that's another option. And we will have to do some studies and research and hoping to do them soon to kind of compare the effect and the results of either method.
And it's interesting. We're learning, we use transdermals. I use more transdermals in my feline patients. I use transdermal medication to manage their hyperthyroidism. So I'm used to administering more for felines than we are for dogs. But I've also interviewed 3 board certified veterinary dermatologists in this last month, and all 3 of them pointed out to me, which is interesting. They said, canine skin is thinner than human skin. They said there's a lot of misconceptions in veterinary medicine, and one of them is that canine skin is tough and thicker. We have a misconception about what can be or cannot be absorbed through dog skin, and that the canine ear skin is actually a perfect vehicle and the perfect thickness to be able to administer medications to. And that I think where the R&D would need to come in is that because canines can absorb transdermal medications beautifully, it's what is the dose that the compounding pharmacist will put in that kind of mother tincture to be able to get the absorbed dose correctly. And that's where a little R&D will, I think, serve us well. We've worked those things out with female hormone replacement therapy protocols in humans. We've done that. I don't think it's going to take too much to get that worked out for dogs. And Homie's doing great with this hybrid protocol. Yeah.
And I'm really glad that you're pointing it out because canine skin and human skin comparison becomes really clear when you see a cut on a human. Like I as a veterinarian, I actually don't really have a problem seeing canine wounds or animal wounds and suture them up. But when I see human skin, it looks so weird. It's actually thick, and I get kind of grossed out. Do you? Like I don't really
Oh,
like
yeah.
human wounds.
Yes. No.
I'm just like so.
And thank goodness we don't
Anyway,
have to deal with that. Yes.
yeah, well, sometimes we do. When I think that I remember I sutured myself up once when I got a major cut and no doctor
I
nearby.
have I have done
Anyway,
that once or twice, but thank
yeah,
goodness.
yeah. So the next thing is suprelorin or defloralin, and that's the medication that reduces luteinizing hormone that causes inflammatory response in the body. And when there is no testicles, it doesn't have anywhere else to go. It goes, attaches to the receptors in the tissues and organs and cells and causes inflammation. So in the hormone replacement protocol that we have been recommending, we use suprelorin to reduce the luteinizing hormone levels. However, in the United States, this medication is approved for ferrets and not for dogs. So we'd like to give you some suggestions of how to approach your veterinarian again or how to approach the situation because this is a practical problem.
It is. And this is why if you can work with a hormone literate veterinarian or at least a hormone aware veterinarian, which means functional medicine, integrative medicine, holistic medicine, not to say that conventional colleagues are unaware. But this is to say that if you were to approach a veterinarian who has never heard of the concept that spaying and neutering could bring about potential long-term unwanted hormone deficiency correlated side effects, if you approach a veterinarian who's never heard of this, you may have a longer, more uphill, more painful communication battle in trying to bring them up to speed around the education. If you approach a veterinarian that gets it, it's a whole lot easier. And because in the US, Peter, I don't know why we don't have Suprelorin injections for dogs, because you have them in Canada.
And in Europe as well.
I don't understand these political pharma laws or regulations. I don't know what's going on, and I don't understand why we don't have access to them in the US other than ferret. But what I will say, having used the ferret product for many, many years on ferrets, it's the same as dogs. So being an exotic animal practitioner and having access to the ferret injectable, I used that exact same product, which is what you're using in Canada and what they're using in Europe. I just used that on Homer. Until we are able to get dog approved injectables in this country, I don't know what other options there are. So that is the choice I did for Homer.
And here we are in front of a situation where we either have a choice of not using anything and seeing animals suffering unnecessarily, or talking to your veterinarian and asking them whether it would be okay to sign a waiver, that he sign a waiver of responsibility for the medication being administered. And ultimately, you are the owner of the animal officially, legally, even though we like to call ourselves guardian, we are the owners legally. And that's why we actually can sign the waiver and confirm that we don't hold our veterinarian liable. And that may be the way for your veterinarian to be more comfortable to actually go that route.
Yes.
And if anyone has any connections, or if you are actually from Verbach, or if you have connections to Verbach, please let us know, because we'd like to open the conversation, the discussion. And we've been planning that anyway, but there's so much work to do that if anyone can help with that particular aspect, or find out who is who in the company and how we can actually connect, that would be absolutely fantastic. And that means not only more health for our dogs, but also more business for Verbach. So I hope that it's going to be actually mutual kind of symbiosis, and that we'll find a way. I'm not optimist. How about you, Karen?
I am hopeful. I'm also hopeful. We use so many drugs, Peter, in veterinary medicine that are not necessarily label approved for the species that we're giving it to. It really is something we've all done as veterinarians. It's really no different in this sense. In my opinion, it's really no different, and it can offer potentially the most life-saving and health-saving benefits long-term. That part of this is just meeting a veterinarian that can see a bigger picture when it comes to what we have done all along in our careers is we figure out how to make our patients feel better using the least toxic medication with the lowest side effects for the longest and best rate of return over time. And this is an injection that offers those benefits. It is unfortunately in the US not yet labeled for dogs.
And so far, and Pax has been on it. He's had 5 these implants now. I think 5, 4 or 5, and he's been doing really well. Like, I don't see any side effects. He's happy. He's inflammation free. Whenever I examine him, he's just so much better than he was before. So I can also report on the potential side effects that are actually none at this point. So that's the good part. And obviously, as we progress and we'll have dogs on it for lifetime, we'll also see if there are any. We're not saying that it's absolutely known, but so far so good. And I personally have been able to, or have been willing to take the risk, because Pax before HRT was not able to hike and swim and enjoy his life. So for me, this is a no-brainer.
First of all, I have had ferret patients on it for years and years and years and years, no side effects. So I'll just pull from my decades of experiences with ferrets, Peter, that in another species, lifelong Suprelorin injections have been a godsend and actually extended those patients' lives. If I'm going to relay that to Homer right now, I am also willing. We do not have long-term, we don't have lifetime studies on Suprelorin in neuter dogs. We don't have that. What I see in Homer with his ability to function optimally as an 18-year-old dog, I am unwilling to sacrifice anything I've seen so far, because I know we will just be going backwards and he will die sooner, faster, in more pain than if I am to continue this protocol, which I will be continuing. So we're in the same boat. We want our beloveds to feel as best as they can. And do we wish we had an incredible amount of information and double-blind placebo-controlled studies over a lifetime to show everyone? We do. We don't have that yet. But what we do have are dogs who's had the best quality of life they've ever had.
This is a true pioneering movement here, and we just kind of have to do more. I wanted to actually just point out for everyone who's wondering why Suprelorin is used in ferrets. It's actually for adrenal disease, correct, Karen? You have more experience, so maybe you want to point that out, that it's actually different. There's a different processing of the Suprelorin, or it affects actually, there's a whole different hormonal axis in ferrets. Their adrenal glands get affected when they get neutered.
Well, same, listen, Brother, same with dogs. Dogs' adrenal glands. I mean, we have studies demonstrating that the risk of Cushing's disease is higher in
That is
spayed and
true.
neuter dogs.
We are here to answer questions about female dogs. There have been a few. Some people wonder about the behavior of dogs that have gone through, or females that have gone through hormone sparing sterilization and what to expect. Second, there are some questions about pyometra and the research behind it. And also, some of you were concerned about possible injuries in dogs that have gone through ovary sparing spay and still attract males.
Females are still going to act like they are intact because they have their ovaries. So, what does an intact female look like?
So, I remember our dachshund Gerda when I was growing up. She went through the stages of heat and she had puppies, and so I remember exactly. In the proestrus, when the body's preparing for ovulation, they start bleeding, and follicular stimulation hormone and estrogen actually rises, and then there is a surge of luteinizing hormone, and that is a signal for the eggs to be released and sent down to fallopian tubes and hopefully meet with sperm in nature. Obviously, we don't want that to happen in our dogs uncontrollably. But in that stage, the bleeding usually stops. So the bleeding lasts about 7 to 10 days. And then there is the stage of estrus, which is the ovulation and the luteinizing hormone surge just right before. And that's when the bleeding actually is not present. The discharge is more yellowish or clear. And people think, oh, my dog is after the heat and it's all fine. No, it's not all fine, because that's exactly the time when female dogs can get actually pregnant. And after the ovulation happens, that's the progesterone state, diestrus, where the estrogen and follicular stimulation hormone drop and progesterone rises. And that's when females become less receptive to males, and they become sometimes a little cranky. And during the 2 month period post heat, if they're not pregnant, they may sometimes suffer from false pregnancy when they start carrying little toys and plushies and making a nest, and even may have a little bit of enlargement of mammary glands. So I remember that all from our dachshund Gerda. She went through all the stages, including false pregnancy when she wasn't pregnant. And then after the first 3 stages, we have period of latency where not much is happening. And that's, what is it called, Karen? I forgot. Oh my goodness.
Anestrus. Anestrus.
Anestrus. There you go. Nothing is happening. What we just described happens in non-hysterectomized female, intact female, but
Right.
similar
Right.
responses and cycle behavior may be noticed and will be noticed in females that go through ovary sparing spay. So for everyone to
Right.
understand that they will be still attracting males, they will go through the stages, but because we are responsible guardians, we will not be actually allowing our dogs to breed and mount and all that.
That's what I think is important, that like during proestrus, a female's vulva is going to get big. Now, she's not going to bleed because if she's had her uterus removed, there's no bleeding. But her vulva gets big, she'll flag, which is the fancy word for she'll be flirty, and she'll move her tail
Tails kind of
aside so
looking
that
side to
she's
side, yes.
and she'll stand to be mounted. But then this comes back to your point that if we know our female has had a hysterectomy, which means all the way down, if the procedure's done correctly, there's zero chance for pyometra, thank goodness, because there has to be uterine tissue remaining for pyometra. If the procedure's done correctly, the uterus has been totally removed. The ligation and the removal of the uterus means that the cervix is only remains. Is there a risk, Peter, that if a female was to be mounted and penetrated, that she could have vaginal wall and vagina trauma because the surgeon has removed some of it, so she has a short vagina? Sure, there's a potential. But then the question is, well-loved dogs in homes that have appropriate guardianship, those situations aren't going to exist. So I think what's important is for pet parents to know, even though your female can't get pregnant, if you leave her out with a bunch of males that will mount her, she will stand to be mounted and she could have vaginal trauma. So like, don't put her in that situation where her hormones make her want to stand there and have sex with a male where her vagina could be traumatized. Just don't put her in that situation.
I'd like to thank you for sharing this. I'd like to kind of adjust a little bit because I've done some research and especially looked for the frequency of these incidents, and they're very, very rare. So unless you have a large dog and a small dog, it is very unlikely that your dog will get injured. So in the unlikely case of this happening, please don't panic. Try not to separate the dogs or anything.
Sure. Yeah.
Just let them be until it all is over. And I'm quite certain that there is 99% likelihood that your dog will be fine. So please don't panic. Nature has done this for many, many millions of years,
And
and so
and it's interesting you say that. I have wondered, Peter, if I've never had any vaginal trauma. I mean, I've never experienced this, but I also have hyper responsible pet parents. Like they would never let their
yeah.
female dog tie with another male because they would
Mhm.
never put their female hysterectomized dog in that situation. It would be a non-factor. But
Yeah.
when you read about this online, I wonder how much of this are people who have overwhelming fear of all of this entire topic, thinking about all the potential scenarios that could come up. How much of this could be a hypothetical fear?
I do have a feeling that this is a little bit of a situation where people exaggerate the risk and worry. And, one little message will kind of explode into hundreds and thousands of messages. And if people are deciding between ovary sparing spay and regular spay, the benefits are greater and the risks are lower of any disease. So I will always choose ovary sparing spay. Of course there is a small risk of some sort of trauma, but it's almost like, if you're thinking of fractured arms, we're not going to amputate the arm just because we can fracture it, right? So we have to prevent these situations from happening. If you have a little dog, make sure that there are no large males around, and especially I would say do not let your dog be mounted and have and intercourse, basically. This is not my biggest concern. My biggest concern is that dogs will be deficient of hormones and have all the terrible consequences of hormone deficiency. So that's my concern. And how do you feel about that, Karen? Do you feel?
I'm right there with you. I think that vaginal trauma, potential vaginal trauma, is it a risk? Sure, but it's such a minuscule, bizarre risk associated with potentially pet parents not doing their job of assuring that a female who is cycling but doesn't have a uterus, she shouldn't be in contact with males that are going to penetrate her. Done. That eliminates that risk. And for most of us, that risk is so bizarrely outside of the realm of possibility that it's a non-factor. Is it enough that we should still discuss it? Sure, and we have, but I don't think that that's like the top risk of the risk of hysterectomy. Can you have penetrative sex that causes vaginal trauma in a hysterectomized female dog? Yes. Is it incredibly bizarrely rare and the likelihood of those scenarios adding up to be possible extra rare? Yes.
Yeah, and so that's actually that settles it. And I hope if you have any questions, you guys, you can definitely bring that up again. But we hope that we answered that as clearly as possible. Now, the next part is pyometra. And pyometra is an inflammation and sometimes infection of the uterus, the lining of the uterus. And it usually happens in the progesterone stage, in the diastrus, because in the diastrus, the cervix closes because the body is preparing for potential pregnancy, and it may trap the vaginal bacteria in the uterus. And it can cause pus buildup, and it also can lead to release of toxins. So, if the uterine stamp is not present, and if the procedure is
Right.
done properly, then it is not possible for us to have pyometra signs in dogs that are spayed by ovary sparing method. So that's super important to remember. There are obviously different forms of pyometra. The open one, when the cervix is still a little open, and the closed ones, it can lead to release of toxins and it can lead to serious problems. And sometimes this condition can be life threatening. So that is why we recommend ovary sparing spay, Karen.
Yeah. So part of the reason that you and I agree that removing the uterus would be a better, safer choice than a tubal ligation, I think both of us agree that if we're going to do a surgical intervention for a female and we choose between tubal ligation or removal of the uterus, the reason that both of us have come to the conclusion that removing the uterus is a better choice is because it also removes the risk of pyometra, which is an important removal of risk. When you do tubal ligation, which prevents pregnancy, excellent, it doesn't prevent the risk of pyometra, which is where our concerns come in and also the concerns of our community. So removing the uterus, if you don't have a uterus, you can't have a uterus full of pus because there is no uterus. However, if the removal of the uterus was done incorrectly, and this is no fault to your blessed veterinarian that tried, this is the fault of our industry and our training, not training us to do the procedure adequately. So we're looking at books and we're watching online videos, and we were not medically trained in veterinary schools to actually know the technique, the surgical approach, the risks. When we went through our surgery rotation, Peter, and we went through junior year surgery as well as small animal surgery as our class, they go into very deep detail about the risks, the pros, the cons. Here are the things you have to watch out for. Here are the things you have to make sure you do. Those are hardcore built-in skills that are in us, all of us, because we learned them in vet school. Veterinarians are not learning hysterectomy and vasectomy in vet school. They're teaching themselves, which means the potential for them to not know exactly what they need to be doing because they didn't have a role model or mentor or a surgeon looking over your shoulder when you were in school, making sure you did it correctly. The risk is there that some little remnant piece of uterus tissue could be left. If the veterinarian leaves uterine tissue, the risk of pyometra is there. If the veterinarian correctly and effectively removes all the uterine tissue, there isn't a risk for pyometra because there's no uterine tissue left.
And there's also the fact that when the uterus is ligated, it's basically closed, and there is not any access of bacteria from the vaginal space into the stump. So I think that we still need to actually wait to see how frequent this particular complication is, because every surgery carries certain risks, and we will need to establish how large the risk is. Now, the other interesting part, and that may be actually useful for those of you who have intact females and also those who have females that have been ovary spare spayed, is that pyometra actually happens more likely when there is elevation of copper, which I know, Karen, you may actually point out a little bit about, because I know that that's your topic, or has been your recent topic. Also elevation of iron and magnesium, and decreased selenium and zinc. So when they looked at the ratio or the incidence of pyometra, they discovered that the copper zinc ratio is increased when the copper is higher than it should be. So that's another interesting kind of element or part of this pyometra issue, because I didn't know that before I went down the rabbit hole of researching and studying, but this is also very, very interesting fact.
I think it's also important then to take a step back and what does that mean for all of us thinking about this? It means that nutrition matters, Peter. It means that us thinking about the quality of nutrition, the way in which we're delivering nutrients, are they in whole food form? Copper coming from liver, whole organic free range beef liver, is an entirely different thing than copper sulfate as a powdered synthetic lab made add-in. Those are doing two different things in the body. So when we think about how our animals are storing and accumulating and metabolizing and processing copper, that matters. Likewise, progesterone is that hormone. Like if you were to put into AI or Google, what's the hormone associated with pyometra? It's progesterone. But that doesn't mean that progesterone's bad. It means that progesterone is the hormone that's going to kick in this uterine lining infiltration and support, and that simultaneously nutrition plays into that, as well as, Peter, prostaglandins and the inflammatory cytokine cascade. The
Absolutely.
amount of prostaglandins that kind of signal, this also plays into why some women have no PMS Some women have a lot of PMS. Why do some women in their first trimester of pregnancy have horrible morning sickness and some women have none? It's these confounding variables of nutrition, prostaglandin, inflammatory status, and your basal hormones that come together to either have a no big deal party and I'm sailing through this and feeling amazing, or this is flipping awful and my body's having worst case scenario reactions. It's similar. So when we think about spayed females, or when we think about the potential or risk for downstream effects from either having a uterus, not having a uterus, or still producing hormones in whatever tissue's left, part of this is genetics, nutrition, but basal inflammatory status. How inflamed are our dogs' bodies? How much central chronic low-grade inflammation is going on? And how many prostaglandins are feeding into that? Those are deep-seated conversations that we're probably not having in veterinary medicine that we should, because those factors play into our animals' risk.
There's so much to talk about, and I know that we are kind of towards the end of time today, but our plan is to discuss the male questions and hormone replacement therapy questions next time. What I'd like to do now is to just invite everyone to share this information with your friends. And also, if you have any connection with Verbac, the company that makes Suprelorin, please let us know. And we will be bringing more information, not only about HRT and ovary sparing spay and vasectomies, but also gathering volunteers to help us with promoting this mission and this project. And we're so grateful for you to be here and listening. And Karen, thank you so much for spending an hour and a bit with me on Sunday while you have guests coming. And I know that you have to run, but thank you so much. And I so appreciate you.
We are so excited, Peter. We're able to come together, answer questions. Like, this is round one of some questions that are great questions. I think we have at least round 2, 3, and 4 when it comes to ongoing questions. We'll just continue having these discussions until we are able to answer enough questions that we all have a general consensus of what we know and what we don't know, and then where we need to go. And it's a really beautiful community that we're creating here.
Thank you so much, everyone. And thank you, Karen. I'll talk to you soon.